function in order for drugs to be eliminated. So for kidney function, you're going to look at BUN, blood urea nitrogen, and creatinine. If both the BUN and creatinine are elevated, the person has renal insufficiency, meaning the kidneys are not working as they should. So both BUN and creatinine elevated means renal insufficiency. The kidneys are not working as they should. Can they eliminate drugs the way they should? No. If only the BUN is elevated, but the creatinine is normal, is in that reference range, it means the patient is dehydrated. So both BUN and creatinine elevation means renal insufficiency. BUN elevation, normal creatinine, means dehydration. The pH of the urine can also factor in to how rapidly a drug is eliminated. And I've given you an example here. If a patient comes in with an aspirin overdose, you're going to give them soda bicarb. It turns the urine alkaline and the kidneys flush out aspirin very rapidly. So if you work in the emergency room, somebody comes in with an aspirin overdose, that's why they're giving them soda bicarb. Changes the pH of the urine, lets us get rid of that aspirin. On the other hand, if the patient normally drinks a lot of cranberry juice that makes the urine acidic, they're going to eliminate that aspirin more slowly. Now in pediatrics, and we consider for pharmacological reasons, a pediatric patient is anyone younger than 18 years of age. So if you have a 16-year-old sibling or a cousin, don't tell them they're a pediatric patient because they're going to be, I'm not a little kid. No, but for pharmacological reasons, anyone below the age of 18 is considered a pediatric patient. And their organ system is not as fully developed as an adult. So their organ system is not functioning as well as an adult. So we have to give a different dose of meds to a pediatric patient than we do an adult. Again, you do not have to memorize those doses. It's in your drug guide. But if you work in pediatrics, that's why the doses are less. Okay, the nurse has to administer 1 teaspoon of medication. How much do you prepare?
5 ml.
So for your neonate, your newborn, your infant, remember their liver is still immature, so they're not producing as much albumin. It means they have fewer albumin binding sites. Okay? Blood-brain barrier is not fully developed yet. Chemicals can pass into the brain, positive things. The liver is not up to speed with producing the isoenzymes yet, so they metabolize drugs more slowly. Now, by about 12 months of age, these organs are up to speed of what we normally consider in an adult. Okay, the nurse notes which drugs have a narrow therapeutic range, also called the therapeutic index, in order to identify what. Why would you have to know which drugs have a narrow therapeutic range or therapeutic index? Because if we don't have a lot of wiggle room between when the drug is therapeutic and when it's toxic, we're going to have to draw blood levels and see where is this drug level. And you're going to learn throughout the semester, next semester, which drugs we have to draw blood levels on because they have a narrow therapeutic and not a lot of room between being therapeutic and being toxic. Now, your elderly patients, their liver function slows down. So they also produce less albumin. They also may not be eating adequate protein. Another reason is albumin lowers. Muscle tissue becomes replaced with fat tissue. So we know about drugs that are heavily bound to fat. They may not drink as much. Why?
You don't want to incontinent.
They may be incontinent. They may be on a medication to help heart failure. That medication is a diuretic. They don't want to have to keep getting up and running to the bathroom. I want to go out and play bingo. I want to go to a restaurant. I want to go to my granddaughter's graduation. I'm not going to drink because I don't want to wet myself. I don't want to have to rush to a bathroom. Decreased gastric acidity. Some drugs require an acidic environment for it to be absorbed. Reduced blood flow to the GI tract. Now we've got a problem with distribution, right? Kidneys not working up to speed. Now I don't mean to say when you hit the ripe old age of 60 that you are suddenly going to just crumble into this little pile on the floor here. Nothing's working well. You're a healthier generation than past generations. You drink water instead of soda. You exercise. You're not as likely, I hope, to smoke. Your nutrition is better because we know about nutrition. So in some ways, you will be much healthier than today's elder. But there are some groups where their children will not live as long as they live. If you rely on McDonald's, Burger King, Kentucky Fried Chicken for all of your meals, and that's what your children rely on, they're going to have heart disease, and they're not going to live as long as their parents. So education's really important. Here are some nursing implications for elders. Have you ever forgotten if you turned off the iron, unplugged your curling iron, put the garage door down? Did I buy ketchup last week? Did you ever forget any of those things? If you haven't, God bless you. I want to study your brain. We all forget things. If you have 9 pills to take a day, do you think, unless you have a system, did I take that? Didn't I take that? We have a lot of babies born because we don't forget. Did I take that birth control pill? I was in Stop and Shop yesterday and looking for vitamins, and this woman was next to me, and she picked up this bottle of vitamins, and it was white lettering on a light gray label. She said, "Look at this." I didn't know. Look at this. How do they expect us to read this? I said, "They don't want me to read it." Like another brand. I think I will. Okay? Just when you have a free moment, go to a grocery store, pick up any over-the-counter medication. Look how tiny the print is. Can't read it. We share meds to save costs. And it's not just people over the age of 60. The EpiPen, I think that company should be put out of business. And I don't usually say that about pharmaceutical companies because we need them. But charging $300 per EpiPen when it is life-saving for people is obscene because it costs nothing to produce. So now they're going to introduce a generic version that only costs $100. Now again, you have patients who need EpiPens and they don't have insurance that covers medication. That company will give you, but you have to ask them for it. But that is just, so sometimes when you do community health, you see people will buy cat food and dog food instead of their medication because their pets have a big part in their life. So you always inquire about being able to purchase their medication. We ignore people 60 and older. I mean, they're done. They're confused, they drool, they wet themselves, they're stupid. That's how many nurses approach elders. Think of your grandparents. If you want somebody to treat them that way, maybe there's an elderly neighbor that you know, always treat people with respect. If you want to open a child-proof bottle, give it to a child who will open it in a nanosecond. The rest of us just struggle. And they use a lot of over-the-counter meds because they're less expensive. Okay, so you've got a client, you've given them Ambien, which is a sedative, you gave it at 11 o'clock. 3 o'clock, they're wide awake and agitated. What type of reaction are they having? Idiosyncratic. It's something that we do not expect. Right? We give you a sedative, we expect you to go to sleep. You're bouncing off the walls. That's an unusual reaction. We see idiosyncratic effects a lot with children and sedatives. You have to peel them off the ceiling, thinking, why is this happening? I take an allergy medication, I want to sleep for 12 hours. I give them an allergy medication, they're bouncing. Just what happens. Herbal products. I've given you a statement here. You don't have to memorize it. Take it to clinical when you're doing a history. It's a way to ask patients if they're taking herbal products without being biased against what they're going to respond, because many nurses do not believe in herbal products. It's the patient's choice. We have to know if they take herbal products. There are a lot of us who do take herbal products. And the reason that we have to know that is because it may affect prescription medication that will also be prescribed. So I'm going to give you examples here. Echinacea. A lot of people believe taking echinacea is going to prevent a cold because it strengthens the immune system. We don't want people who have had a solid organ transplant to take echinacea. We're trying to quiet their immune system down so they don't reject the solid organ. Right? So echinacea would not be beneficial for them. Now with all of these herbal products, we have anecdotal evidence of how they react, but we don't have any definitive research that says, yes, echinacea has been demonstrated to reduce the likelihood of getting a cold. We only have what patients tell us. Ginkgo biloba slows how quickly the blood clots. Okay, you've got a patient on anticoagulants. You don't want them to take this herbal product because it's going to prevent clotting even more than the prescription medication and make it hemorrhage. There's no rigorous testing of herbal products. When you go in and buy an herbal product, you hope that you're getting what they're telling you in the dose that they're telling you. The FDA thinks that they're dietary supplements, so it does not regulate them like medication, meaning there's no quality control. Okay, so what is your responsibility when giving medications? You have to assess, you have to intervene, and you have to evaluate. So when you're gathering assessment data about how that chemical is acting in the body, you will look at all of these things. If the drug has a therapeutic range, what's the lab test that tells you what that patient's number was? What about liver function tests? What about renal function tests? All of that will be available to you. What about the bone marrow? How well is the patient producing red blood cells, white blood cells, and platelets? You're going to assess for therapeutic effects. If I'm giving an antihypertensive and the patient's blood pressure is still 170 over 110, this medication is not working. I can't just chart it and go on. I'm going to check it 2 or 3 more times, and I'm going to call the healthcare prescriber and say, I gave blah, 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 at 10 o'clock. It's now 2 o'clock. The blood pressure is still 170 over 110. They're going to prescribe something else. What side effects is the patient having? Are they having any adverse effects? I can guarantee that every single one of you will make a med error if you do not follow the rights of medication administration. I made a med error, and I'm going to tell you about it so you don't make one. In the olden days, before Pyxis, we used to have med trays, and we put the med cards and the patient's meds and a pill. We'd be walking the patient's room, and I thought I was hot stuff. I had my BSN. So I walked up to Mr. Jones and I said, Mr. Jones, here are your pills. And he said, okay, and he took them. And the very second he went, I knew that was not Mr. Jones. Now, were those pills just like a stool softener and a vitamin? No. They were all cardiac meds. Did he have a cardiac history? No. That's it. I was too smart to check the name bracelet. That was beyond me. So, nurse's station. This is it. My husband's going to drop out of law school because I just killed somebody and he's not even a lawyer. He can't even defend me yet. So I said to Mr. Jones, I gave you the wrong medication. I'm going to call your doctor. That's okay, honey. And I'm thinking, oh no, it's not. So I said, before I call the doctor, let me just check your blood. Now, I was going to check his blood pressure. It hadn't even been in his stomach long enough to be absorbed, but I just needed to do something. So I called the doctor and said, I'll be right in. So I must have checked every other patient I had at least 10 times before I let them take the pills. All right, he comes in, he said, what did you learn? I said, I learned that I'm not too slow, that I have to follow rights of med administration. He said, okay, let's go see Mr. Jones. Mr. Jones thought this was wonderful. He was getting so much attention, the other patients were jealous. He said, Mr. Jones is fine. You learned a very valuable lesson. I said, I promise you I will never be too big for my britches. And he said, I know you won't, just continue. Now, what did I do? I told the patient to be told. I told the doctor, I filled out an incident report, and I learned a lesson. Now, the fact that I'm telling you this, I'm giving you a lesson. Never think you are above following the rights of medication administration. And do not rely on the fact that, oh, we've got computers now, I scan this, I scan that. They're paying you to think. If not, they would just put the pills in a little robot that travels along and gives the patient their medication. I want you to read why nurses make med errors. It's on your learning module. Make sure you document what you've given. And make sure you always teach the patient every single time you give them their medication. I am giving you warfarin now. It's an anticoagulant. It's going to help your blood to take longer to form a clot. I am giving you labetalol. It's a beta blocker. It's going to help lower your blood pressure and lower your heart rate every single time so that they begin to know what they're taking. You also have to evaluate, are we getting a therapeutic effect? And are there any adverse or side effects? So research has demonstrated that what percent of patients continue to take their medication as prescribed. These are people who need the medication for life. What percent? Yeah, it's about 50%. So, now, this is for chronic. Here we've given you a prescription. Okay? They've given you a prescription. You're going to go to the drugstore because that's how we've been programmed. But only 88% of you are going to get that prescription filled. To tell you what it's not. When you get home, only about 3/4 of you are actually going to take it. You paid for it, you're not going to take it. Half of you about are going to continue taking it, taking the full prescription. About 25% of people take meds exactly as prescribed. Have you ever been prescribed an antibiotic and decided I don't need any more after so many days and it says take it all? I'm going to save it for when I need it again. What you've done is help that little bacteria mutate.
So the 88%, that means like not the first fill.
88% is just going to get it filled. They're going to walk out with that prescription. But only 3/4 are going to take it. Why? We get home, like my mother, and she starts reading all of the side effects. She tells me, I'm not taking this. Yes. No, I won't. Why? And she starts reading 50 different side effects. Mom, even one person out of 1 million had a side effect they have to publish. I could be the next one. Thankfully, she doesn't have to take much. I think she has one thing to take a day. That's all I can deal with. Okay. Don't memorize this. Take it to clinical. Have a conversation with your patient. You sometimes forget to take your pills. We all do. Do you? We say we all do, then they know, gee, I'm not the only one. Sometimes people don't take their meds for reasons other than forgetting. You ever decided you weren't going to take a pill for another reason? We're trying to understand patient compliance. There are lots of reasons why patients don't take meds as they should, and don't try to memorize this laundry list of things. When you read it, most of it's going to make perfect sense. Right? Might be inconvenient to take my medicine as they prescribe. I'm not going to do it. These drugs are more harmful than beneficial. Look at all the side effects. Maybe I didn't get any patient teaching before I left the hospital. Why do I have to take a beta blocker, a calcium channel blocker, and a direct renin inhibitor, all for my blood pressure? I'm just going to take the cheapest one. The nurse didn't explain how they all act differently. Okay, so what has research demonstrated? People think they're taking the meds the way they should. It's only when we ask them, Tell me how you take your medications every day. That we find out that they're taking the statins, which should be taken at night, at 7 o'clock in the morning with all their other pills. Now, they're still taking it, but they may not be getting the full benefit of it. So, you don't reprimand the patient, you notify the healthcare prescriber. Now, Mr. Smith is taking his statin at 7 a.m. instead of 7 p.m. I just wanted to let you know. But he did tell me that he's taking it every day.
So we should not say anything to the patient? Do they not take it?
If they're going to start the medication, you're going to tell them it's been ordered to take in the evening because. They come in 2 years later and they tell the nurse, I just can't remember to take it at night, I take it in the daytime. Say that's okay, I'm going to let your healthcare prescriber know because sometimes this medication is more effective in taking in the evening, but it's better to take it in the morning than forget to take it or not take it. Now, they did a study, people your age, they had insurance. 27% chose not to receive healthcare treatment, medication, because they did not want to pay the copay. 20% skipped taking the medication as prescribed. 17% split the pills in half to make them last longer. So they had healthcare insurance, which paid for the medication. They didn't have enough money to pay for the copay, but they had other reasons. So we sometimes think, oh, a patient has healthcare insurance, they're going to take the meds the way they're supposed to. It may not happen. People make errors in medication at home. 1 out of every 2 of your patients may have difficulty understanding the directions about taking the meds. Although pharmacies are getting much better with spelling everything out, no abbreviations. Most medication will make us nauseous. People stop taking it. I don't want to feel that way. About half of all children who are to receive acetaminophen liquid for a fever get the wrong dose. Why?
Because most of the at-home people don't use the exact measure, they just use a teaspoon or tablespoon,
Right.
and depending on what spoon you use, it could be a different amount.
Perfect. Exactly right. They just grab a teaspoon. So you make sure that all of your pediatric patients are sent home with a calibrated device. It looks like a little spoon, but it's calibrated, and that they can see the calibration, because usually it's like a whitish plastic with a white line. Make sure they can see it.
I have a question. Can we just, let's say you don't have it, and can we just tell them that they can use like baking measure spoon?
No. Get it from the pharmacy. We'll get it for them for free.
That seems coming to that.
Most medications now, like my daughter's 6 months old, will come with an actual syringe. So we have like a few of them now. And you go to like she's teething, you go to replace the acetaminophen, they give you a
Good.
So there's just something.
Good. Excellent. If we don't get involved in educating the patient does not get educated about their meds. Make sure you listen to your patients. Sit down and listen to them. We send people home on an inhaler. We don't show them how to use it. We tell them to look on their peak flow meter, which we'll learn about in a couple of weeks, about danger zones. We don't show them what that means. So make sure your instructions are very clear. I'm going to go through this rapidly because I want to get to part that you do not have, so you can see something. You are going to stop potential med errors. It's not the pharmacist, it's not the barcode scanner, it's you. You may get medication X for a patient. That's what the order says. Barcode is scanned, everything's fine. You think, why is the patient getting medication X? They don't even have heart disease. Why are they getting an antihypertensive? Their blood pressure is normally 100/50. Don't just be a robot and say, oh, that was the order, the pharmacy sent it up, it scans, here, take it. But a patient now in shock. So you take time, you call the healthcare prescriber, say, I noticed that you ordered this antihypertensive for Mrs. Smith. Mrs. Smith's blood pressure has been running 100 to 106 over 50 to 60. Oh my gosh, it's on the wrong chart. You just saved a patient. That's what they're paying you to do. Use your head. I'm going to show you a slide. I want you not to talk to anybody around you. I want you to write down what the slide says. Right? Do not talk to anybody around you. Write down what the slide says. Or you can type it, I don't care. All right? We ready? Okay. The statement was Paris in the spring. How many of you think it's at Paris in the spring? Don't be afraid. It said Paris in the spring. Let's see if I can get back here. My computer doesn't make it. Let me see if I can. Right? I showed you that for a reason. Microsoft is not responding. Ah, change this one. We all have confirmation bias. We see what we expect to see. Paris in the spring is a common phrase. That's what you thought you saw. Now I'm showing you that because I want you always to take the extra 30 seconds to really look at that medication and make sure you are seeing what is on that bottle. Heparin, 20,000 units per milliliter. What color is that information in? Red, right? Red or orange? Heparin, 1,000 per milliliter. What color is that in?
Same color.
Same color. You're busy, you grab one. Your brain says, oh, I remember that color, and you have the wrong medication. Take the time to look at it. Look at this. Hydroxyzine, hydralazine. 50 milligrams, 50 milligrams. 100 tablets, 100 tablets. One is an antihistamine, the other is an antihypertensive. Really easy to grab the wrong thing. The reason I didn't give you long to scan that, Paris in the spring, is because you scan 30 to 40 pieces of information every second. Slow down. And I don't care what the pharmacist sent up, they are human too. So I'm going to send you these Do you have those on your slides? The reasons why, okay. Make sure you read the research posted there about why nurses make mistakes. These are real mistakes that people have. People make. If you ever give your pills to a patient, here are your pills, scanned, and the patient looks and says, those aren't mine. The worst thing you can do is say, yes, they are. Because the patient will take them. You are an authority here. They may be the wrong pills. Now, different pharmaceutical companies will manufacture the same medication once it's released and color it differently. So if the pharmacy buys pills from Pfizer, the pills may look different than what the patient was used to taking from another pharmaceutical company. Just go back and check again. Patients do not know the name of the pills, may not know what they're for, but they know what they look like. Hydrochlorothiazide is a diuretic. Clopidogrel is an anticoagulant. Patient takes the diuretic. It's got the U-128. Sometimes the wrong pills are put in the wrong bottle by the machines that fill the pills. So the patient looks at that and says, that's not mine. Don't argue with the patient. I've told you about class 1, 2, and 3 recalls. Class 1 recall means that the patient, do you have that in slides?
Mm-hmm.
Yeah, okay. It just, no, because I want you to do something so that you're going to remember about compliance with medication. You can listen to these on, you can either read them or listen to them. Class 1 recall was like I showed you, the clopidogrel and the chlorhydrothiazide. The FDA stopped that medication. Pharmacy had to pull everything off the shelf because the machine that filled the bottles put the wrong pills in it. Okay, now we're going to do a little fun thing. This is some research. It was done in 2015 about pills. Which pill do you think, this was done with regular people, not nurses. Which pill alerts you to the seriousness of the medication? Do you think it's the red pill or the blue pill? Which would you think is more? Mm-hmm. Yep. It's the same medication. One's red, but red means stop. Which pill is the least bitter?
White. Light blue.
Was the light blue, because they think of yellow like a lemon. A lemon is sour, a lime. So the light, now this is just perception. It's not what really is happening with the medication. Which pill is best at treating a headache?
A.
Red.
They chose white because most people think aspirin relieves a headache. Aspirin tablets are white. Which pill is the hardest to swallow? The diamond. Now these pills are small, but still it's got that shape. Which pill is least effective in treating a headache is the least bitter, and the least alerting means serious. It's the oval. So, the takeaway point here is the shape, the color of the pill. People look at it when they get home and they think, oh, I don't want to, it's going to be bitter. I'm not going to take that. I can't swallow that. It's not going to be effective. This is all perception. All right, have a wonderful day. I will see you next week if you have any. What now, for next, if you have any questions on anything on the study guide, whatever, send me an email. I will post week 2 slides before the weekend.
Davis, online, it only has like a track of,
See all of it.